This is Dr. Thomas Klein. I'm coming to you from Raleigh, as you probably already know by now. And this is a Monday series to discuss the humanitarian crisis that's been created by forcing doctors to become so frightened they're taking their patients off their long-term critical medications. Critical medication is a medication you're giving that if you stop it, you immediately cause deterioration in the health of the person. There's not a lot of critical medications. Insulin is the best example. If you stop insulin in an insulin-dependent diabetic, within a day or two, they're in serious health consequences. So critical treatment is different than regular treatment. When a doctor abandons a patient for any reason, say leaves town or closes their office, they're required to give a 30-day notice to the patients, help them find another doctor. But if the doctor is providing critical treatment, it's the doctor's responsibility to find another doctor themselves, not just tell the patient to go look for another doctor, because there's not enough doctors taking patients with rare painful diseases in the United States. So we're recommending that the Public Health Service, in conjunction with the public health officers at the CDC, begin to set up pain rescue practices until enough physicians are recruited back into the fold by letting them know they're not going to go to prison or lose their licenses because of treating pain patients with opiates. And the DEA can tell doctors what they're not going to arrest them for, which is basically if you're selling drugs to people who are not your patients, that's cause for arrest. The boards who have accepted the CDC guidelines need to realize the CDC guidelines wrote new parameters for drugs that were not approved by the FDA, and that means the states have adopted something, CDC guidelines, and nullified the federal law setting up the CDC, setting up the FDA. So back to our polls that we did, and these, as I mentioned, are sidewalk polls where we just ask people. Usually we have 100 to 400 people. So this is about benzodiazepines and pain medications, which are pharmacologically an excellent combination. And we had a huge number of people, almost all, said that there was a benefit from giving the two together. The benzos control the spasms, and they also help with the effects of the opiates. A ideal combination, and ironically, people are so running scared, they're telling their patient to stop their benzodiazepines. Now, when you stop a benzodiazepine, you put a person's life at risk, because their withdrawal can be like alcohol withdrawal of delirium tremens. And delirium tremens is when you abruptly take alcohol away from a true alcoholic or from a benzodiazepine user. They're liable to die. I've seen people die during withdrawal of alcohol and benzodiazepines both. This is serious business. So, were you forced to choose between your benzodiazepine, or it was okay? So, a quarter of people, their doc said it's okay. 3/4 of people said they were forced to pick one or the other. I've been doing this a long time, and there is no rational or ethical reason to tell people to stop taking their medications unless there's a medical reason. I mean, I suppose I could just go around and tell people, stop your blood pressure medicine. I don't think you should take it. Stop your insulin. I don't think you should take that. That's what's happening. How many of you went to the emergency room with a painful condition, were denied the use of pain medicines? 90%. How many of you with rare painful diseases find that fatigue is a major problem? 80%. At National Pain Council, we're researching the whole idea of these rare painful diseases, and we believe they're part of a larger syndrome called persistent inflammatory diseases, which also includes the autoimmune diseases. The common feature amongst all of them, even autoimmune disease, is this awful fatigue that is so bad you can't move around. You can't get up and cook yourself lunch. It's not pain, it's fatigue. There's a disease called chronic fatigue syndrome, and we think that's probably not an isolated disease. We think that's really kind of part of all these other diseases. But 80% severe problem with fatigue. Now, if you take opiate pain medicine for the fatigue part of the diseases or part of chronic fatigue syndrome, did they help? Didn't help in 20%. Helped a lot in 60%, and helped some in 20%. So 4 out of 5 people improved their fatigue with opiate pain medicine, probably because of the anti-inflammatory effect. Okay, about withdrawal. This was an issue that the CDC and its consultants claim that people stay on their medicines long term to avoid withdrawals. This is true in addiction. It is not true in pain medicine given to people with rare painful disease. That's a terrible error in logic. You can't take different diseases and compare them. Heroin addiction disease is a totally different disease than people in pain. So we do know that people with heroin addiction disease, the withdrawal is probably the main reason people stay on their medicines. And it's really horrible. Having talked to a couple of heroin addicts, the withdrawal is just unbelievable. It's totally different than pain medicine. So how bad was the withdrawal from your pain medicine patients? A third said they had no symptoms. A few people had mild symptoms. 14% or 15% said it was a bit troublesome. 43% said it was really bad. So that means the majority of people that go through withdrawal from their pain medicines, and you do, that they got through okay. Okay, the last one here was 200 people, and it was about neuropathy. The claim is that opiates are not used in neuropathy. You use antidepressants. Antidepressants don't work. We've done previous polls, and they just don't work, and have horrible side effects, and you can't get off of them. So what if you took just plain old pain medicine that supposedly doesn't work? This shocked us. It worked to relieve any type of neuropathy, especially the small fiber neuropathy and diabetic neuropathy, which are very, very painful. It worked 90% of the time. We are preparing a list of conditions, and we're finding that more and more conditions respond very nicely to opiates that are not traditionally treated with opiates, one of them being rheumatoid arthritis. We have another poll that a surprising number of people with rheumatoid arthritis actually did very well with opiate pain medication. Well, that's the last of our polls for now, and I will see you next Monday. Good night.